So thank you all for being here. I hope people are enjoying the presentations. I know I am. We're going to get into the next one. So I have I'm Elizabeth Cope, by the way. I'm Vice President of AcademyHealth, which is the professional organization for health services, research, and policy. You probably don't recognize me because there's that picture of that lady. And she doesn't usually come to the presentations. This lady comes. So I do have the distinct honor and privilege today of moderating our panel that is focused on critical research needs in climate health and planetary health. As I was flying in yesterday, I found myself reflecting on the unique position all of these panelists find themselves in today. In its first month since taking office, the Trump administration has issued a number of executive orders and policy statements impacting higher education and scientific research. Early actions have included freezing federal grants, reducing the workforce at scientific agencies, restricting access to federal data sources, cutting scientific research funding, and limiting research topics, with climate change, health equity, and DEIA topping the list of their banned topics. Many of these actions are being challenged in the courts, and it's unclear how many of them will ultimately prevail. Nevertheless, the overall posture of this administration in its unnuanced pursuit of shrinking federal government and deregulating industry threatens our nation's ability to make scientific advances that will save and improve the lives of millions, our nation's position as a global leader in science, and the sustainability of academic research, and hence our nation's economy and scientific workforce pipeline. So I was thinking about that as I was coming in to moderate a session on research, and thought, we could choose to sort of spiral and lose ourselves in hopelessness and despair. And this is a temptation that I find myself having to resist on almost every day. Or we could organize, stand up, and fight. And pretending the climate crisis is not happening does not, in fact, stop it from happening. We don't need magical thinking to save us. We need research to tell us what strategies will and will not work, where they will work, and importantly, for whom they will work. We face a complex crisis, one that cannot be attributed to the actions or policies of any single driver or set of actors. Complex problems require complex solutions. This is an all-hands-on-deck situation that we find ourselves in. And we need an evidence base that is fit to purpose. So today, I am pleased to introduce my esteemed panelists who are going to help us think through how we build that evidence base. What research is needed? How should that research be done? And what should that interface between research and action look like? So today we will be hearing from Caitlin Rublee, Kyle Hill, and Carlos Faerron Guzmán, in that order. In the interest of ensuring we maximize the amount of time for discussion, I'm going to invite my panelists to briefly introduce themselves as they deliver their opening statements. And following those statements, we'll have some discussion among the panelists before we open it up to hear from all of you. And I think this has been working this way with the app and the Q&A in many of the sessions. So to help with that portion, just make sure you have those conference apps open so that you can readily submit your questions. And it'll be my pleasure to elevate those questions for panel discussion. So without further ado, I would like to invite Caitlin up to the podium for her opening statement.
How is everyone doing? Oh, it's so quiet. Come on. It's after lunch. It's after lunch. You should be excited. Okay. We should. Yes, exactly. So I'm Caitlin Rublee. I'm an ER doc, day and night. So it's lovely to be awake with you here today. But I think you're in for a real treat for the next hour or so, hearing about solutions, transdisciplinary teams, systems thinking, and redefining evidence as what we know it, right? So you heard the word from Elizabeth of evidence. What is evidence? Let's turn that around. What is evidence to each and every single one of you as health professionals, as experts? And so over the next couple minutes, I will share my intake as a health professional myself, but really looking and turning towards communities and saying, what are community-led solutions? They are there all around us on a local scale, on a global scale. What could it look like to integrate as part of the teams and empower and give agency to traditionally underrepresented groups? So I'd like to start here. Join me in the emergency department, right? Oh, this is a little bit of my home. Maybe you guys are a little anxious, but this is where I live. I'll see thousands of patients a year. Okay, this was one patient who had an acute cardiac event, who came in, required a highly skilled team of health professionals to provide care. You can see there's intubation equipment and items to put in a central line and IV medications that ultimately we got the patient to the intervention they needed and intensive care, the intensive care unit where they received prolonged care for their acute event. You see, as health professionals, we are witnesses, and this is evidence. This one patient is evidence. The thousands of patients I see per year are evidence to the health impacts, to the suffering from acute and chronic climate stressors, from injuries and diseases. You see, a lot of what we do is pattern recognition of the injuries and diseases that result directly and indirectly due to climate change, like many of you see. We are also witnesses to the health impacts of policies. You see, in caring for the downstream consequences of our patients, it helps us look upstream to solutions. And that's why many of us as health professionals are vital stakeholders when it comes to transdisciplinary research. This should not be new to any one of you. The health effects of climate change are to specific organs, organ systems. Heck, there's 27 ways a heat wave can kill you, and probably more, right? So sometimes heat directly kills, but also indirectly related to accelerated death due to chronic diseases, increased costly emergency department visits, and prolonged hospitalizations. There's also increased utilizations of EMS or ambulances. Some of my patients, especially in rural areas, tell me that they might call 911 and it might be 1 or 2 hours before someone responds. There are also impacts related to healthcare infrastructure. Emergency care is a beautiful thing, and it halves mortality in many places of the world, just having trained emergency medical personnel. In the setting of climate-related disasters, floods, fires, we're seeing infrastructure disruptions, power, water, and that affects patient care in the immediate term and for long term, long after the event. So what are the evidence needs? Here are 3 I offer. Number 1 is a climate-informed health workforce. This is part of capacity building and why many of you are here, not only able to recognize the insults to our patients, but also to use our experience in systems thinking and our collective knowledge to become members of the team, as you'll hear from Kyle and Carlos. Number 2 is real-time data. This isn't just any data, right? It's data linked to healthcare delivery and linked to preparedness. This isn't just for high-income settings. This is particularly true in places that are developing systems. In places like small island developing states and low and middle income countries where they don't even have data right now. What could it look like in order to build the infrastructure linked to health now to measure the insults now and for periods of time to come? And then the third and most important is narratives and lived experiences. You'll hear more about this, but really amplifying our patients' experiences, amplifying what they are feeling and living. That is evidence. and looking to it as community-led solutions. Many of them have the answers. We just have to listen and empower. I would like to share one example with you from Nepal. And this was work done with the National Academy of Medicine and Inter-Academy Partnership. Essentially, Nepal is a very climate vulnerable place. You can see it's for flooding. Essentially, the entire country is at risk of at least medium or high risk flooding. It's situated between India and China. As such, many of the people recognize climate change and climate insults and want to take action. So we partnered with Partnership for Sustainable Development Nepal. They talked about the dengue surges that they've been feeling and seeing and experiencing themselves. They didn't make a Zoom call one day and they said, we have dengue. This is something they are living with. And so they said, what can we do? And it was to convene. It wasn't just to convene academia or government, it was to convene everyone. And so in the last year, they brought together over a workshop, government, civil society, academicians, scientists, health professionals like yourselves, and said, climate change is about health. What can we do to take steps to improve the health of our people? It's for people, it's about people, and we are working together to make this happen, not only in Nepal, but as a region. You can see it was even attended by their prime minister there. So the evidence, it was for the people, from the people, about the people. And I think this is the value that we bring in listening to so many of our patients' stories here and abroad. I'll just leave you with this as we transition to the next speaker, because more and more we're going to talk about evidence linked to action. Evidence linked to action, right? That's the goal. So in looking at different domains that influence decision-making, you can see here there is a complex set of not only research evidence, the best papers, PubMed, but a strong connection of resources, including personnel like yourself, in order to make things happen. I will go ahead and pass over to Kyle next. Thank you.
Haumatakiapi, Chante Washte, Nape, Chuzapido, Kyle Hill, Makchapi. My name is Kyle Hill. I'm an assistant professor at the School of Public Health at the University of Minnesota in the Division of Environmental Health Sciences. Really grateful to be here with you all today on this esteemed panel, just to talk about something that we feel passionate about, but at the same time, we have a charge to move forward in this really difficult political climate. And so today I'll be talking about braiding Indigenous knowledge in Western science to address climate change. And so first off, I'm going to try to learn how to use this. As Indigenous people, we've been here before. These are some pictures that have an emotional resonance with me. On the left, what you see is early time in the mid to late 19th century. A policy was to terminate American Indian communities. And as I reflect on that, I think about these are buffalo skulls, and to us as Dakota people, Lakota, Nakota people, this is what we call our Pateoyate, which is the Buffalo Nation, and a really important kin that we hold dear to us. And this is really the center of a lot of our spirituality. This is, of course, a part of our food systems and historically part of our clothing, part of tools we use for ceremony, for our livelihoods. And of course, here you see what would have been a flyer to sell during westward expansion of all our lands. And so many of you have heard 80% of biodiversity is protected by Indigenous communities, which make up only 5 to 6% of the global population. And what some scholars did using archival mapping and other geospatial methods is they realized that in the US alone, American Indian Alaska Native communities only live and inhabit on 1.1% of historical homelands. And I think it stands to reason that recently on a trip to Vermont for the National Nature Assessment, I talked to an Indigenous scholar from Brazil who's having to meet with companies and global corporations that are asking her, some of her indigenous tribes there, about purchasing rights to the land for carbon offsetting. And so I think when we hear that, 80% of biodiversity is protected by indigenous peoples, we have to think about opportunities to be able to take care of not only our indigenous communities, but our ways of life, our ways of knowing, epistemologies, ontologies, because that is the true source of what we're talking about for planetary health. And so here, this is Anishinaabe communities and our migration from the East Coast to all these major stopping places to where food grows on water, which is Manoomin, our wild rice. And so here we see also a year-over-year increase in water temperature on what we call Gitchagami, which is Lake Superior, or the largest freshwater lake in the world, which is threatening the ecosystems for things like wild rice, for other ecosystems in the water. And then here is ice cover duration, so lessening of ice extents year over year in these Great Lakes as well. And so as I reflect on what a colleague, dear friend, and relative on the Indigenous determinants of planetary health, Nicole Redvers, I think about this very simple framework here that describes how the determinants of planetary health can support our work and again, the braiding of Indigenous knowledge and Western science. Indigenous peoples level, and my work, especially at the interconnecting level, which really helps us understand that there's an epistemic divergence of our scientific approaches that doesn't have to be combative, but we can help support the actually weaving and braiding of these two knowledge systems. Now, I think what's difficult is right now we have an administration that is trying to be the vehicle for that divergence of our two knowledge systems. And in the past 4 years, we've seen an administration that has done whatever they could to support that in many ways. But I think what we're left with is the understanding that at the federal level, state levels, we can throw money at it, but 4 years is not enough time to do it justice, right? And so this is the Indigenous Holistic Worldview from the Status of Tribes and Climate Change, Volume 1 report that was released in 2021. We're releasing, I'm an author on the second report, which is coming out in any month now. And so this is a framework that helps us understand how Indigenous worldviews can be incorporated into our scientific frameworks, our processes, our designs, and help support us. So what we see here is you have 7-generation approach, which I heard someone kind of allude to this before, which is every decision we make now, we have to consider how it's going to impact not only our children, but their children and their children after that. Right. But we also take the wisdom from folks who were 1 generation, 2, 3 generations before us in making those decisions. We take the guidance and ancestral knowledges, epistemologies, ontologies, ways of being from our ancestors and apply this within kinship ecologies, epistemologies to the work that we do on the land. And so our Indigenous communities, American Indian communities, wherever you live, I think what was said before, like a lot of us have specialties, and we've worked hard. We've done a lot of education in these specialties to become who we are. I will say that for a lot of our Native and Indigenous communities, they also have specialties, which is land stewardship, right? There's people that carry those knowledges forward. And so how do we develop alliances? How do we collaborate? How do we develop coalitions with them in a way that of course, we can't rely on federal funding like we were hoping, But that doesn't mean that handicaps our ability to develop connections and kinship and be allies. And so I wanted to leave you with that, right? And then finally, this is just a picture that of communities doing buffalo restoration practices, which I really appreciate because not only am I wearing a shirt with all buffalo on it, that's just a coincidence, but I really love how this, when we think about that first picture, and not a coincidence, but the Department of Interior and Bureau of Indian Affairs put out funding for buffalo restoration work weeks ago, and I haven't checked on that. I wouldn't be surprised if that's frozen or discontinued. But I think these are attempts to, recenter us, to bring us back from the brink of, as we said, some tipping points that are really dangerous. By 2050, we're hearing 1.5 Celsius for global warming. We are trying to protect 30% of our biodiversity by 2030, and they're trying to dismantle all of that. And so I look to this, I go back to community, and it feels good. There's still opportunities for us. And so when I look at you and when I listen to you, and just being in community with you all, I feel good here. I feel like we have opportunities still, but it's up to us to develop our networks, to develop collaborations that can really weather this storm, and one cool thing about Buffalo, and I'll leave you with this, and I've heard some of my good friends and relatives talk about, because they're presidents of tribal colleges that are really bearing the brunt of this administration. But what they'll tell us is that when Buffalo face adversity, they come together with the youngest in the center. And what they do is when there's a storm coming, they charge through the storm, knowing that what's on the other side, there's the other side to that storm. And so I think that's our charge, as a community, as a collective of scientists, as care providers, healthcare providers, is to come together, and I think as we embody that, this work will become not only easier, but I think it'll come towards us as well, because we're exercising that kinship beyond boundaries that I think right now are trying to be driven between us. And so I'll leave it with that. Thank you very much.
Hope so too. All right, can you hear me all right if I stand at this distance? Great, I was nervous. I was gonna lean like. I know, I didn't know. No, but I'm glad you can hear me. Okay, thanks for being here on a Sunday. I know that's you're taking away from families and friends and things that are also important, but this is also important, I would say, right? So, as Kyle just said, my name is Carlos Alberto Faerron Guzmán. I'm Costa Rican. I work for the Planetary Health Alliance, and I interface in different spaces. Some of them relate to communities, some of them relate to decision makers, some of them relate to educators, some of them relate to researchers. And although I'm here to talk about planetary health research, I'm not a hardcore researcher myself. I'm not in what I would call discovery scholarship. I'm more in the integration scholarship space. So I wanted to clarify that. And so don't ask me anything about modeling or, network-based or actor-based systems. I know very little of those. I kind of can speak of those broadly, but not necessarily in all that detail. So just a show of hands here, who does research in this space of climate change or interface between grand environmental challenges and health? Perhaps a third of you. Okay, that's good. So some of this will resonate, and for the ones that don't, hopefully some of this will resonate as well. I'll give you a broad overview in 3 points. I wanted to keep this very general and just as well to get an understanding in the room, how many of you are familiar with the term planetary health? Okay, most of you, that's great. Excellent. So my job here will be easy. And as I am trained as a physician, although I don't work as a clinician anymore. I stopped working as a clinician perhaps 10 years ago. And as a clinician, though, I do have like a structure in my mind, and we should always say like, oh, we need to start with a diagnosis. That's the key, because if we're going to talk about solutions, like solutions to these planetary health research challenges, we need to have clear what the diagnosis is. So kind of broad brushstroke, what are we talking about when we talk about these pitfalls? And I think both the speakers that preceded me have spoken to these things, right? There are pitfalls to our current landscape in research, and some of them have already been addressed, right? So it's not that much. And in red, you'll see that these are just some examples of each of these points. They're not the definitive list of things, right? They're just examples. So for example, we seem to have a knowledge action gap where we've accumulated all this evidence and all this knowledge and all these large scale research projects from many decades now in many cases, right? Especially when we talk about climate change and how we knew this was coming decades ago. And yet we still don't have the action that we need. This is why we're here, right? So, and with this understanding of climate change and other changes in our environment, right, like biodiversity loss and pollution and changes to our oceans, we've better understood how these are impacting people's health and well-being. Yet, however, right, we're still not there when it comes down to closing this action gap, especially from our decision makers, right? And because of this, right, decision makers still are relying with these overly simplistic solutions to these complex problems, as it was addressed by our moderator, Elizabeth. So that is part of kind of the challenges. We also seem to have these structures that keep us on these funding and publication traps, right? And so we favor this incremental, siloed approach, and we've talked about this so many times, but we really need to transforming structures, right? And we can talk about examples later on what is a real structure that will favor interdisciplinary or even transdisciplinary approaches, right? And funding traps and publication traps might be things like very short-lived funding cycles. It might be, these narrow departments that fund narrow research projects, and then those stay in those departments, and then they don't speak to each other. And we see this every day to day in our universities, right? We talked about complexity, and kind of the opposite of complexity is reductionism. And we still are falling in this trap of reductionism, trying to find these very linear, very easy to study ways. You have a single exposure, things like, oh, how does climate change affect mental health? How does biodiversity loss affect my nutrition? However, these are embedded in very complex scenarios where the social, the political, the economic, the cultural, and other environmental stresses are all coming together in order to affect this. So we really need to, go beyond this reductionist model to go to a very complex model, because we're missing out in the understanding of feedback loops. We're missing out on the understanding of cascading risks, and we really are ignoring in our methods as well how we're going about to understanding this. And finally, we have these power and equity issues around who sets the agenda, what kind of terms are favored, what kind of methodologies or epistemologies are favored in our research methods as well, who benefits from these research fundings, who's leading, who's at the table. All these things are related to these power and equity structures. So when we see kind of this would be the diagnosis, I would say. So in summary, kind of my main first point is our current research approaches are falling short, right? This is kind of the diagnosis very clearly. Now, the second part is around how complexity and interconnectedness can help us understand this better, right? And we have in this graph here, very simply put, what we call kind of these large-scale anthropogenic changes to the natural environment, right? So we have things like global-scale pollution, global-scale land use change, global-scale nutrient overloading, phosphorus, climate change, resource scarcity, marine degradation, biodiversity loss. All these things are happening simultaneously. There's complex feedback loops between them, and these are all affecting our health, right? That's the core component. One of the core understandings of planetary health is that these changes are impacting our health, right? And that is done through these other means, like the exposure to good or bad air quality, good or bad water, good or bad in quantity of food, toxic exposures, infectious disease exposures, all mediated by these things that we call the determinants of health, right? Whether your socioeconomic status, where you're in a place that has good health systems, bad health systems, and eventually it'll impact, these spheres of health. And as well, these spheres of health are interconnected themselves, right? You can't talk about non-communicable diseases without talking about nutritional diseases, without talking about mental health. These are all interconnected. So really, when we think about planetary health, it's trying to really make us understand that all these things, there's large interconnected pathways that are keeping this as a system, right? And we need to think about this as a system. And you've seen this graph before. Actually, you haven't seen this graph. You've seen an older version of this graph. This graph will be released soon in our new Planetary Health Alliance website, which I'm just putting a plug in there. Wait for it. It's coming very soon. And then on the other side, we have these things called underlying drivers that are driving these systems change. Things like consumption patterns, things like value systems, things like our cultural things like our demographic changes, technologies, among very much others. So keep in mind that in order to study, right, what these environmental changes, we really need to understand this as a complex phenomenon, right? So how is planetary health then appropriate for tackling these challenges, right? So this planetary health research really tries to shift from this reductionist approach to this system-based approach, right? And that requires methods, people. It requires different approaches that perhaps in our linear models and in our departments, it's not necessary that we can find. One of the key things that we need to start designing for when we think about research is research for action, not just for publication or not just for this reward system that we're all playing. I'm part of this reward system that we're playing. And I was told, hey, if you want to make associate professor level, you need to publish more. It didn't tell me I needed to solve more things. No, they didn't tell me I need to have more impact. No, they told me you need to publish more and you'll get a nice salary raise. So I'm part of the problem as well. University systems are part of the system. This reward system is part of the problem, right? We need to center our agendas around equity. That just doesn't just mean who's being impacted more, but also trying to understand who is causing more part of the problem. And as well, how do we think intergenerationally about this? We need to, again, highlighting this case, we need to change our methods, change our epistemologies in order to capture the complexity, leveraging things like big data, network-based modeling, multi-hazard interactions, all these things that kind of we hear about, but yet we're still not working in these interdisciplinary teams in order to get there. So this is just, again, my third point would be planetary health research principles can help. So this is my invitation to all of you to really, as well, try to use this framework. We talk about, researchers need a common language in order to collaborate, right? But it's not just researchers that need a common language. Communities with researchers, policymakers with researchers, funders with researchers, and all those actors need common languages, right? We believe at the Planetary Health Alliance, of course, that planetary health has that opportunity to be that common language. So we invite you to become part of our community, just putting a plug in there. October will be our annual conference in Rotterdam, yes? And so hopefully as well, you can join us there. And thank you again for having me. And I'm looking forward to this discussion that we're going to have just now.
All right. Can everyone hear me? Okay, great. I was worried I was going to need like a framework and a toolkit to turn this microphone on. Well, please join me in thanking our panelists again for some excellent opening statements. So I really was struck by a number of themes that emerged through each of the presenters' opening statements, particularly around the way that we need to bring different ways of knowing or different ways of thinking about answering evidentiary questions through frameworks and approaches that can be used in mutually reinforcing ways. And there are times where it's not always necessarily obvious or self-evident, I think, to many in the research community, how you interweave these approaches together. And so I'm just kind of wondering, as we think about the fact that this panel is about research and finding answers to our big scientific questions, what are some of the really big we need to know, right? Because if we talk about the know-do gap, right? So what do we know and we don't do, but then what do we not know? And so when we think about the things we don't know, what are the kinds of questions that kind of come and rise to the top for you all as ideal questions for these kinds of approaches?
I'll start by saying, I think what don't we know? We don't know how to work well across knowledge systems. I think that's a clear understanding. I think we don't get taught that. There's very few people that have the privilege to go through an education that teaches them and to not just to do it, but to value it right, that working through these knowledge systems. So I'm just going to throw that out there as a first thing. We don't know. And I think we need more efforts in our education systems, and Planetary Health Education tries to do a little bit of that. It's not completely clear exactly how to do that because it's going to be changing from context to context, right? So that is part of it, right? I would say, what do we don't know? So my summary is we don't know how to work across knowledge systems.
Following from that, I think when I was at COP26, we did some creative resistance campaigns for some of and that was in Glasgow, Scotland. One of the pieces I think that came from that was just this little screen print that was colonialism caused climate change, and I think when I talk about the epistemic divergence, and what Carlos was alluding to is like, there's been very deliberate attacks on knowledge systems. Whether it was eugenics movements or whatever that came from, but just this post-positivist or whatever to elevate certain ways of knowing, certain scientific trajectories above others. And so part of, I think, climate justice in Indigenous communities is recognizing what was attacked and bringing that to the fore to start to develop a just opportunity for that to be able to flourish or blossom. And when we talk about climate change research or planetary health research, we recognize that our Indigenous communities have really robust nature-based solutions that are local in scale and scope, and they are really important for something like sequestering carbon, and can support us getting, the restoration of biodiversity, and so I think that's what I would say to that is it's not so much about what we know or don't know, but I think it's a lot of the emotional valence of fear, what we've feared and what we have attacked, and what we've attempted to erase as a society. And I think that the innovation here at this moment and in this instance might be allowing an opportunity to see that, and to experience it.
I have a couple thoughts. One is really turning it back to the community and thinking about patient-centered health outcomes. What matters to the people? That's going to vary from community to community. It might be never coming to the hospital. It might be having communication and early warning systems in their language. It might be having extra mobility services for them. And so really looking at individual communities and turning it back towards them. The second thing I want to emphasize is it kind of goes back to the old public health adage, which is what gets measured gets done. And so thinking about numbers and action, as we've all have emphasized, what would it look like to emphasize positive health benefits of policies? Right? If we can develop a language with these decision makers, with these policy makers, and so that every single policy has a health benefit linked to it, or even a health consequence. But I think really transforming the dialogue and seeing policies as solutions, and then saying, with the closure of this power plant, we're going to see this many reduction in asthma cases coming to this emergency department, making it real local, having the constituents involved, and putting a cost to that. It can help articulate across different aisles as well.
Thank you for that. That was fantastic. I want to build a little bit on some of the points that you all have been making as it relates to thinking about how we integrate different ways of knowing together in the service of scientific discovery and solution discovery. In a climate right now where there's a lot of examination of scientific findings and attributing them to things like junk science. How do we make the argument for weaving together different ways of knowing in a way that also combats critics who may try to attribute some of that to junk science?
I say we go ahead and model it. I mean, there are so many amazing people in this room and collectively across our institutions, across this nation, around the world, going ahead and modeling the systems thinking, the transdisciplinary teamwork in order to emphasize these solutions is going to demonstrate optimism and positive effects to our people. I think about patient care sometimes too, in regards to what happens if the patients were empowered to know what the health effects of healthcare delivery was in that they were doing, that they were getting. What was the pollution cost of all of those labs and the plastics and the imaging and the transportation that they took, the ambulance or the helicopter to get what they needed? What would that change? Maybe it wouldn't be anything, but I bet for a lot of people it would be something. And then it adds transparency and quantification to the effects and bridges, again, many of the concepts that are so abstract, understandably, for many people. So I would say go ahead and challenge us all to model those teams within our hospitals, within our clinics, within our academic institutes, within our organizations in order to make it happen.
Yeah, I mean, I think the question is like, who is science working for? You know, and a lot of the things that we we point to for indicators of successes, especially in work with health equity, is we compare races to each other, you know, and health disparities. So if we're arguing like the science as we know it now is working for everybody, that's a false. So if the question is like about junk science, then what is good science? Is good science where only, you know, one group of people actually, you know, and what does that say about our state of science? You know, and I think when I brought up the example of carbon offsets and carbon credits earlier, what does that say about the ability for some of these indigenous communities globally to be able to steward their lands and resources when our corporations want to buy that land to offset their, you know, their CO2 emissions? I think it says they're pretty damn good at whatever they're doing. You know, the evidence is plain. It's, you know, decreased as emissions, you know, and so I guess that's it. You know, I think our communities have historically been marginalized and disenfranchised. The ways of, again, the ways of knowing, like my communities, I forgot to mention it, even though it's on the slide. So I'm an Anishinaabe. I'm enrolled in the Turtle Mountain Band of Chippewa, Dakota, and Lakota from the Sisseton-Wahpeton and Cheyenne River Sioux tribes. But our communities have calendars that correspond with planting seasons, with harvesting seasons, right? It's not just September and August and this and that. Like it really says in our own traditional tribal languages, like this is the season we harvest wild rice. This is the season when we plant. This is, right? And so that's built in. So imagine a child learning that calendar. That calendar tells them how to behave. You know, it tells them how to relate, to be in relationship and kinship with the lands, you know. And so I would say the evidence is there, but we're just looking in the wrong place for good science or good evidence.
Perhaps I'll focus the question a little bit on the messenger of the science. And I think one key issue here is that probably decision makers can't tell from, you know, junk science incorporated and Lancet countdown level science, right? They probably don't know even the difference for the most, or the staffers won't be able to tell which is quality and which is not if unless they're familiar with the name The Lancet or something like that, right? So many times it's the messenger that will play that important role. And I'd like to, I mean, as well, many times that messenger doesn't have to be the researcher, doesn't have to be the PI, doesn't have to. There's some exploration in certain institutions that are trying to bridge the knowledge action gap, especially through policy, with incorporating within the university structures former policymakers that can go and knock with their own peers. We talk about communities of knowledge. Policymakers are their own community of knowledge. They have their own practices. They have their own way of understanding knowledge. They have their own way of incorporating and implementing that knowledge. We researchers have one way, then communities have other ways, and doctors have other ways. So everyone has a specific culture. So the messenger is important. I always tell my students, if you want to sell a Pepsi in Detroit, you have M&M do that, right? M&M will sell you that Pepsi. The similar way, if you want to sell your message in policymaker space, you need to send a policymaker, a person who is eye to eye, who sees them. But that policymaker needs to be trained in that science. That policymaker needs to be working for these research institutes. I collaborate with an institute in Spain called ICE Global, Instituto de Salud Global in Barcelona. And what they've done, they've hired former policymakers within the university in order to bring the science into the policymakers. I've noticed that in Barcelona, that is highly effective around things like fighting against urban heat island, fighting against air pollution, fighting against droughts. These are influencing policy because it's the same policymakers that are acting in the name of science, right? We have to take a hint from the private sector who does that through lobbying. They call it lobbying. We call it other things in academia, right? But we really need to start learning from their book as well. And we can do this in our institutions by these interfaces, these actors that are not necessarily nodes in the systems, they're connectors of systems. We need to think about that as well.
Thank you very much. I'm going to try to get this in under the wire. Take one question from the folks in the audience, which, oh no, and then I lost it. Guys, got to stop upvoting stuff so that it doesn't change the order here. So I'm going to try to remember it. As we are watching a lot of disruption happen in academic research right now, or at least, what may be coming. A number of folks made comments also related to the challenges that we face in terms of the way our incentive structures are set up in academic research and the way that we don't necessarily promote a focus on collaboration, a focus on impact, all of those kinds of things. So what are the kinds of changes that we should be advocating for in terms of how our academic research enterprise is set up to help position us collectively toward prioritizing these kinds of approaches?
I'll just start saying, let's not, what's the saying? Let's not let the perfect be the enemy of the done, right? So don't think that you're going to design the perfect structure in your center, in your department, in your university, because that's not going to happen. These things are iterative. They're going to change with time. They're exploratory. They're experimental. So start with something. If the structure means like, hey, a small grant that is, at the, whatever center of interdisciplinary learning in your university, you start with that small, perhaps 50,000, 100,000. You don't have to go with a $5 million grant right away. You start small and then you start growing, you start proof of concept. And I think that's one way to go about it. Hopefully, of course, you can also lobby your leadership in order to change structures within the universities and as well get funders on board with this. I know people like the Wellcome Trust have explored around planetary health and interdisciplinary research projects, right? Stop with this linear models. And I would say, again, just don't let that, bet it be perfect before it's done. At the Johns Hopkins Institute for Planetary Health, where now the Planetary Health Alliance is based, the exploration comes through faculty networking, right? That is a start. Faculty networking in the form of faculty dinners, reunions, seminars, meeting weekly, Zoom meetings, in person, building relationships, and then you start finding common grounds between faculty members and incorporating themselves in each research projects and starting with that interdisciplinary approach. Same can be done with other communities of practice, policymakers, communities themselves, et cetera, right? But again, I would say incremental, not necessarily, going for the Super Bowl of interdisciplinary research projects. I think that's silly and it'll just stall progress.
I'll address one issue in medical training, and that's the cost of education and something like public student loan forgiveness. You have to work full-time clinically for about 10 years in order to make that happen. And so I think that really disincentivizes some of the creativity and non-traditional approaches in joining policy arenas and all of these other things that health professionals need to be a part of. Because you're kind of stuck in this mold of training, and then I have to, do individual patient care, and I'm stuck in the micro level, and I'm not incentivized to take a step back and look at the macro level. So really looking at different departments, broadly speaking, and their junior faculty, what does time support look like? What does mentorship look like? And not traditional mentorship, but inclusivity and people who can demonstrate and model the kinds of transdisciplinary teams and community-led solutions that we need in order to incentivize agency and empower a whole new generation of change makers as we move forward.
Yeah, we are. So thanks, everyone.